How can we achieve a crystal clear cornea on the first post-op day after doing phacoemulsification in this eye, which has a brown mature cataract in an 8-year-old lady? Hi, this is Dr. Deepak Megur. Welcome to another interesting case. I tried to provide some insights into the principles of managing such cases and how can we achieve a clear cornea on day 1 post-op, and also a few tricks and tips I'll be sharing through. So in these cases, the most common scenario would be very difficult to break the posterior plate of the heminucleus and then also the smaller fragments. Now, how do we achieve that? So it will all be demonstrated in this video. The surgery is being performed under posterior subtenous anesthesia. The side ports are made. The anterocapsule is stained. Dispersive OVD is used to fill the anterior chamber. As I'm placing the dispersive OVD in the antechamber, please note the position of the cannula the way I place it. It's usually placed along the opposite angle and then the dispersive OVD is pushed in, which results in burping out of the air bubble. The globe is stabilized and a posterior limbal sclerocorneal tunnel incision is created. Time to perform the rhexis. We have a calcified plaque, but thankfully it is at the center, so it's very easy for me to get around it and create a rhexis which is about 5.5 mm. The rhexis which I am creating is slightly bigger than my usual rhexis, simply because for harder cataracts it's always safer to make a bigger rhexis. So I have a well-centered and appropriately sized rhexis for this density of the nucleus. In mature cataracts, I usually avoid hydrodissection, but in this case, an elderly patient, I was expecting some zonular weakness. I'm just doing very minimal hydrodissection just to ensure that the nucleus is free from the attachments to the capsule. Once it's confirmed, I proceed to nucleus management. The nucleus division strategy which I am going to follow in this case is going to be a stop and chop technique. The superficial epinucleus in the soft cortex is aspirated out. The true color of the nucleus is now laid bare once the superficial fluffy cortex in the epinucleus is taken care of. The dark brown nucleus is staring at me. So before I start sculpting, let me share the settings which I'm using here. The standout feature is I'm going to use a 95% phaco energy, which is torsional. The machine being used is Infinity. I'm having a very low flow rate of about 16 and a vacuum of about 120 with a bottle height of 90 centimeters. The plan is to create a long trench, and as the sculpting is begun, please note the position of my chopper. The chopper is held over the nucleus. It's in fact supporting the nucleus so that as I'm sculpting, I'm not inducing any stress on the bag. So this stabilizing the nucleus helps us to get better purchase with the ultrasound power. And one of the most common mistakes done by the beginner surgeon when sculpting is instead of using more ultrasound energy, they try to mechanically push or shove the nucleus. And this induces a lot of zonular stress. So you need to be as gentle as possible with the phaco movement, but you should be full throttle with your phaco energy on the foot pedal. So as you can see that the nucleus is being cut with not so much of a difficulty because I'm using very high amount of energy, and using this torsional ultrasound does help since the incidence of wound burn is almost none, even using 100% of the energy, and the cutting efficiency of the balance tip is exquisite. So you stabilize the nucleus with the left instrument in the non-dominant hand and then make these passes. So the amount of energy which is delivered is always titrable because we're doing it under linear control. The foot pedal is going to control the amount of energy which is being delivered. So the nucleus is then rotated and the same sculpting maneuver is continued. Well, one of the more common questions always asked is how do you assess the depth of the groove? Well, there's no simple answer to that. The honest answer is always going to be experience. Because once we see the posterior plate getting thinner, then you realize that you're the right place. So I'm aiming at least 85 to 90% depth in this hard cataract, because I don't want to struggle at all while doing lateral separation and division of this heminucleus. So I want to go as deep as possible. 90% is what I'm aiming at. So as we go deeper and deeper, we can see that the lamella of the nucleus becomes thinner, and you can see a little bit of a transparency which improves. That should suggest that we are nearer to the posterior plate. And I also want to ensure that the groove is quite long enough, so I don't want to struggle at the ends as well. So when we're making this sculpting, it's important to realize that the nucleus is a biconvex structure. So we need to go in depth maximum at the center and not at the periphery. So if you go deep at the peripheral parts, we are at risk of entering into the posterior capsule. So that's the reason this concept has to be very clear, that the nucleus is a biconvex structure. The maximum depth is always going to be in the center, and the peripheral is going to be relatively shallower. So now the time to divide the nucleus, the chopper and the phaco tip is placed way deep into the groove. It's important to ensure that these instruments are placed just above the posterior plate. By placing them so deep, we require very less energy to crack the posterior plate. So when we are not manipulating it too much, we're going to induce significantly less stress on the bag and the zonules. Time to divide the first heminucleus into smaller fragments. The settings are changed. Now we're going to the chop mode. I'm going to use only the longitudinal energy in burst form. The tip is buried into the nucleus. The sharp vertical chopper goes down vertically, and then there's a lateral separation maneuver. So it's expected that you're not going to get a full thickness crack in the initial chop itself. The tip is still held buried into the nucleus while the chopper goes down at a much deeper plane, and then we induce lateral separation a couple of times until the piece is free. So we need to be mentally prepared that you need to perform this chop and lateral separations at multiple levels at progressively deeper planes. So having a chopper which is slightly longer does help us so that we can reach the posterior plate much more easily. So with this heminucleus, I've got 4 smaller fragments. The settings are changed now to the quadrant removal mode, wherein I'm going to use the torsional energy only to emulsify these nucleus. Please note the level of the emulsification of the fragments. So I'm not in any hurry to finish the case. I want to go in slow, but I'm very conscious of the plane at which the nuclear fragments are being emulsified. As the fragments are moving around, you can clearly see that the plane is at the level of the rhexis margin, or maybe a little bit higher, but significantly away from the cornea. So using the right amount of energy so that we have minimal turbulence ensures that we don't get the lens chatter and the lens fragments running around and hitting the endothelium of the cornea. So judicious use of energy and selecting the right plane of emulsification helps us to emulsify these nuclei with the least amount of trauma to the endothelium. With the first heminucleus out, before dealing with the second heminucleus, time to replenish some OVD. So dispersive OVD goes in first, followed by HPMC. So we're back in the chop mode, and I'm going to use the longitudinal energy. The tip is buried until it reaches the sleeve so that I get a good hold, and then the vertical chop maneuver is being performed. You can clearly note that there's a lot of torque when I'm doing this chopping maneuver, simply because the bag is empty, the heminucleus doesn't have any support of the other heminucleus. So that's the reason why in such situations where you don't have compactly arranged nuclear fragments, the vertical chopping can induce a lot of torque and movement and can be less efficient. The fragment is again consumed using just the torsional energy at the right plane. So this is the last big piece, and I need to divide it into 2 fragments. So as I told during vertical chopping, we require compactly arranged nuclear fragments for it to be very effective. But in this case, because we don't have adjacent nuclear fragments, dividing this nucleus with a vertical chop through and through becomes a little bit tricky. So as we can see here, I'm unable to crack the posterior plate. The nucleus is moving around. I'm unable to hold it steadily. So one trick in such situations is I follow when the bag is empty. It's easier for me to flip the nucleus around and attack the nucleus from its back side. You know, the posterior plate is where it is holding on. So I'm going to phaco that the area where the posterior plate is held. So it's much more easier and quicker and less stressful on the bag. So with great ease, I could separate these 2 fragments. However, the catch is I can't use this technique when the entire bag is full of nucleus. So this technique of breaking the posterior plate by flipping it around can be done only when the bag is reasonably empty. At least 1 or 2 pies of the nucleus should have been out, so that we have good amount of empty space to flip the nucleus back and then phaco the posterior plate itself. So this is one trick which I follow in all these hard cataracts. So I don't struggle too much to separate the posterior plate, just flip it around and phaco the posterior plate. It should be fine. Again, mind you, the plane of emulsification is extremely critical. So people often blame the phaco energy for having a bad cornea on the first post-op day. Actually, it's not true at all. The majority of the trauma which happens is purely mechanical and also could be because of a superficial plane of emulsification. Even if you're using more ultrasound, as was in this case, it was all being delivered in the bag. So the amount of energy which is delivered, and it's how far away from the cornea, that is more critical rather than just having a high number. The last piece of fragment is emulsified. Let us see at the total amount of dissipated energy, the CDE, that is cumulative dissipated energy, showing 46. This is significantly higher than most of my cases. They would be around 10 or less than 10. So even with this, it's almost 4 to 5 times more than my average case. And let's see how the cornea behaves in the next post-op day. Once the cortex is aspirated, the bag is filled with OVD and the single piece foldable hydrophobic lens is placed into the bag. The OVD is removed and time to close. So these are the first day post-op pictures. The cornea is extremely clear. Patient has a vision of 6/9 and she's happy. So to conclude, stop and chop technique is a very efficient technique in managing these dense cataracts. We can break the posterior plate by doing a deeper groove, and effortless breaking of the posterior plate ensures that the zonular health is not compromised. Just to reiterate that the higher amount of energy always does not necessarily mean corneal edema or damage to the cornea. The place at which the energy is delivered and the plane of emulsification of these fragments is far more critical than the amount of energy which were used. So following these right principles in these dense cataracts can give you crystal clear corneas on day 1. Thank you for watching and hope you found this helpful.